Pulling the plug on health care waivers. The Obama administration announcing it's going to end temporarily. Anyway, reprieves for employers who are struggling to meet new coverage requirements.
About 1,400 waivers to businesses and union groups have been handed out already. But Dr. Sreedhar Potarazu, president and CEO of Vital Spring Technologies, he's both a businessman and a doctor, says shutting down these exemptions will have a severe impact on health care coverage and job growth. He joins us now with more. Doctor, there were a lot of people who didn't like this in the first place. They said it just indicated people were trying to opt out immediately because they saw it would cost them more. Now you're saying that even though the president wants to stop it, or the administration, that this would actually hurt things more. How so?
Because employers are going to essentially do one of two things, Liz. Either they're going to pay the penalty and not offer the benefits at all, which is bad for the employee, or the other thing is that they're simply not going to hire because they can't afford to provide this minimum level of coverage. So both of those have a huge impact in terms of getting the country out of the doldrums of the unemployment rate and trying to hire. This is an enormous cost of the $1.2 million in minimum coverage that employers have to pay now. That's just not sustainable. And so it's a huge problem now in terms of how they're going to have to hire.
Well, let's look at a specific company. McDonald's got a waiver, and McDonald's, as we know, hired 50,000 a couple months ago, actually led to the employment rate going up, which we thought was great. Of course, then the next month it went down again. But would McDonald's have hired those 50,000 had it not been for that waiver?
No, Dave, I think that's a great point. They were the first to come out of the starting gate, and that was the administration's concern, that if employers said we're going to shed benefits or shed employees, that this is going to look really bad in terms of the perception of the law, that you started to see the waivers kick in when companies like McDonald's were offering these mini-med programs. And I don't think McDonald's would have gone out and hired 50,000, and I'm very skeptical they're going to be able to afford to keep those on. Now, remember that those that have applied are able to apply for upgrades or renewals within this time frame. So maybe they're still going to get the benefit and not let those 50,000 go. But the bigger picture really is that many employers are already considering, as the McKinsey study revealed, a couple of weeks ago, that there's a large percentage of people that are saying, you know what, we may end up just getting out of the business of providing benefits and let people either figure it out on their own and buy it on their own through the exchanges or get on Medicaid.
Okay, and what would be so bad about that if you allow people to make that choice and have that sort of involvement in using their money, hopefully, because if you do it that way, then people start to be very, very judicious. Where would be the problem in that?
Well, there is no problem in utopia, but the problem is that we're not. But the problem is that we're not there yet. And the government hasn't set up the consumer to be able to make those choices and pick insurance plans and give them the things that say, all right, for what I need, what are my options? Where am I going to get the doctors of my choice? So we're just pushing them over the cliff and saying, you know what? You're going to have to make your choices. Things are not really set up.
And you're saying, doctor, that the choice will be that they'd rather pay the penalty than have to cover the employees that they have. Won't that hurt them in the end for employee retention, to keeping the good quality staff?
Sure it will, because, we've talked about this before. 60 cents on every dollar for the employer is spent because that worker is not at work, able to be productive and able to grow revenues for the company. So if the employee's not happy, if they're not healthy, then that's a huge economic impact. But nowhere in this law have we addressed that component of the economics of how we're going to solve that. It's been this jack in the box, let's see how far we can keep cranking it before the snake opens up and pops out. And that snake's going to be the employer when they said, we've had it. That's enough. We can't take it anymore.
By the way, have these exemptions cost the government any money so far?
We don't really know what's costing the government and what's not costing the government, David, because it's such fuzzy math. So at the end of the day, it's absolutely costing the government if we can't pay for the deficit. The idea of adoption of the law and getting people insured within the programs was all part of the program. But if we issue these waivers, we've just dug a deeper hole in terms of how we're going to pay for it. That's part of the concern going into the election that I think the administration is recognizing when people say, wait a minute, we're already dealing with this enormous deficit. You promised us that the bill was going to pay for itself by X, Y, Z. You've now given all these exceptions. How does it work?
Yeah, the exceptions make it very questionable. Doctor, thank you for joining us.
Thanks, Doctor.
Thanks for having me back.
Dr. Sreedhar Potarazu, President and CEO of Vital Spring Technologies.